Hey, welcome back. We are pivoting to page 80, act relating to the Office of the Healthcare Advocate. And we have with us today both Blue Cross Blue Shield and MVP. So we'll start with Sarah.
Great, thank you. Sarah Teachout with Blue Cross and Blue Shield of Vermont. I'm here to talk about the one section in H80, which is the one on rate review. And it changes the way that questions are asked of the insurer from the Healthcare Advocate's office. So currently, the Healthcare Advocate submits their questions to the Green Mountain Care Board. The Green Mountain Care Board looks at the questions. I'm assuming they're looking for duplication and maybe questions that they don't feel are relevant to the decisions around the rates. And then they forward those questions that they've maybe pulled to the insurers. And then we have 2 weeks to respond to those questions. So we respond to questions from the consulting actuaries for the Green Mountain Care Board, LNE. We respond to questions from the Healthcare Advocate's office. And then we also respond to questions from the Green Mountain Care Board members. So there's a lot of questions. We're happy to answer questions. It's part of the process. I think the idea is to give everyone information in advance of the hearing. So our concerns are asking lots and lots of questions that may not result in a better outcome or better inform anyone in making the rate decision. So I have proposed language, and I will go up to it. It's on the screen? Yes, okay. So I add the word reasonable questions and then directly related to the filing. So those are my requests, that you add those words. And then I will stop sharing this and I'll share with you. There's a link here, and then I provided the document. In 2017, I think it was for the 2018 rate hearing, the Healthcare Advocate's office asked 35 questions with 52 sub-questions of Blue Cross and Blue Shield of Vermont. So that was a lot of questions. And I just took out 3 in particular to give you an example of questions that we felt were not reasonable. So the first one here was incorporate recent trends towards long-term birth control methods into your utilization projections, and that it is likely to decrease unintended pregnancies. So to just start out, that's not how our actuaries do population projections. You know, they're projecting the whole population. They are doing it by age strata, but they're not doing anything at that level of detail. So we also felt that it was honestly a very politically charged question. The next one, provide whether every employee was getting the same salary increase and provide the last 3 years of inflationary and merit increase percent by salary decile for every employee at Blue Cross and Blue Shield of Vermont. So we provide a significant amount of information about our administrative costs, our employee compensation. We provide how much we're giving in total in aggregate of raises or merit increases to all the employees at Blue Cross and Blue Shield of Vermont, because that feeds into rates. Administrative costs are part of the rate process. And then we also file documents with the Department of Financial Regulation. It's called the Act 152 report. It's on their website. Every one of our executives' compensation and the breakout between their salary, their incentive, and any other compensation they get. So we really do feel like we are transparent about our employees' salaries and merit increases, and that this would not have better informed the board or anything to do with the rate decision. And then the last example I have here is perform a study about costs being driven by changes in services moving between provider types. So just basically, in a 2-week time frame when we're answering questions, it's a pretty intensive time. We don't have time to perform an entirely new study that doesn't have anything to do directly with the rates. So we felt that this question as well was unreasonable. Just to share it with you, I'll stop sharing this one. I can just share the question document too. Sorry. I don't know what I did. Here we go. Share again. I don't know where they went. If you click the link, you can see all the questions, the 35 questions, the 52 sub-questions. It was pretty lengthy. So the state of Vermont has, I believe, one of the most comprehensive, but also, administratively expensive and burdensome rate review processes in the country. It takes a really long time. It costs a fair amount of money and resources for all the parties, not just Blue Cross and Blue Shield of Vermont, the Green Mountain Care Board, the Healthcare Advocates Office. We are all work very, very hard on this. And we really would like to provide the information that everyone needs to make the decision, but we don't want to, go into some really unreasonable and excessive kinds of things. We also can oppose the questions. That takes our outside legal attorneys. They have to write a legal, reason why they think the question shouldn't be answered. And then the Green Mountain Care Board attorneys have to decide, make an opinion whether or not that's true, and tell us whether or not we have to answer the question. So there is a process, but that adds a lot as well. So I very much request that we include the term reasonable and have directly related to, for if we're going to change the questions to come directly to the insurer.
I got a question. Reasonable to who? I think that's a vague question or request.
I get it. And I asked some lawyers what they thought. I asked our outside consulting attorneys who help us with the rate review process. And she felt like reasonable was a standard she could argue in the rate review hearing. So, I get it. There's reasonable, relevant, related to lots of legal terms.
I guess I'd leave that out and just put directly related to the file. But reasonably, it leaves a lot to. I think it's reasonable, you might not.
True.
Leslie, what was the word that we came up with? Was it reasonable when we were talking about the bill yesterday? There was a relevant. So would that?
Yeah, so
That'd be a help.
again, also I asked our consulting attorneys, they said relevant is the lowest standard.
Okay,
So that pretty much allows
everything, but reasonable is a higher standard than relevant?
Not really. I mean, okay. It's the directly related to is a big key part of this.
Yeah, that's where it's the directly related part. Daisy.
When you first opened up, you said that these questions being asked were not only just of high volume, but that they don't necessarily lead to better outcomes or better healthcare for people. How do you know that?
So I think MVP can give you better insight because they do rate review processes in New York and in Vermont. My experience is only in Vermont. I don't think our premiums, I know our premiums are not less than those elsewhere in the country. I'm not sure that we have better, so our standard here is access to care, affordability, and then the actuarial standards, which are, math standards essentially. And I think the other one is, I should have looked up the standards, they're in statute, but, we review more standards in our rate process than other states. And I think, you all we've had a lot of discussions about whether or not our rates are affordable, whether or not there's better access to care in Vermont. And it's probably not better here for all of the additional work we're doing in the rate review process.
I'm curious. In during the 2018 rate review, you said that Healthcare Advocate submitted 35 questions with 52 sub-questions. So are those ones that they submitted under the current process, which they first have to submit to the board, who then decides whether or not to pass them on?
Right.
Are these the ones that were just submitted to the board, or are these the ones that were actually passed on by the board to you?
So these were the ones that were submitted to the board. But what you're doing in this bill is eliminating that process.
Were these were these 35 questions and 52 sub-questions passed on to you from the board for you to have to answer?
Not every one of them.
Not everyone.
But you're moving to a process where now
Yes.
there won't be any,
Can you say how many?
I can look it up.
Yeah, I'd be curious how many they let through there.
You know, every year is different.
And
and
18
I
was a
will-
long time ago too.
Yep, I'll say in recent years, the questions, I think in the last couple of years, every single question's been passed on to us and we've answered all of them. So it's a different board, it's a different legal counsel at the Healthcare Advocates Office, but that doesn't mean things couldn't change in the future. And we really just want it to be directly related to the rate hearing.
Any other questions for Sarah? And, well, go ahead. Sorry, Leslie.
Well, I'm just curious about, do they have any other opportunity to ask these kinds of questions throughout the cycle, like, the reproductive health questions, that kind of stuff? Is there any other access?
So they can ask questions at the actual hearing,
Mhm.
but I will be honest, our actuaries, without doing research, couldn't answer those questions.
Mhm.
And again, I'm not sure how a question about long-acting birth control is relevant
No, I
to
hear
a
that.
rate hearing.
No, I hear, but that's not my question. My question is, do they have access to a response to a question like that outside of the rate hearing throughout the year?
I mean, they can ask us a question anytime. I don't think our actuaries have a response to that question.
No, but that's
the
not
level
that's
of
not my
detail.
question. My question is,
Okay,
do they have access, don't use the reproductive health,
sure.
whatever question, do they have access to you to get questions like that answered outside of the rate review hearing?
The Green Mountain Care Board does. I don't believe the Healthcare Advocates Office does.
Okay.
Yep.
Casey?
I'm curious if, and I don't know if you're ready to have an opinion or a formed one on this yet, but do you imagine that the rest of the bill might change the amount of questions that the Office of the Healthcare Advocate might have during the process? Because there are some other elements that we've changed around this process for them. So I'm just curious what you imagine, would those questions be answered earlier on so that ultimately for you, there would be less work to do in the end?
I'd like to think about it. My initial reaction is no, but let me think about it.
Yeah, sure.
Any other questions? I think I'm gonna go to Jordan right now and then possibly our healthcare advocate afterwards can come on and comment on. So we'll save some questions for him. Welcome, Jordan.
Good morning, everyone. Can you hear me all right?
Yep.
Great. Jordan Esty, for the record, representing MVP Healthcare. By way of reference, we've got about just over 30,000 members in Vermont's qualified health plan, individual and small group commercial markets. So I apologize because I missed the first portion of Sarah's remarks, but I did have a chance to look at her written testimony, and I can be brief because MVP's feedback is very much in line with Blue Cross's, and that is, we're neutral on the bill, I would say, but just in terms of the rate setting process with the board as it is today, that's a very costly and labor-intensive, time-intensive process with very tight timelines, for our respective organizations to navigate already, right? So issue is not so much with, the healthcare advocates' ability to ask questions and be a full and equal participant in the process. We certainly appreciate the important role that they play. We would have concerns about just, the scope of questions and whether we could reasonably, pull together responses in what is a compressed time frame. So we would support amending the language to ensure that the questions that are asked are, very specific to the rate filing itself, or would give the board some ability to an extended time frame, for example, so that we can reasonably pull together, responses to appropriate questions. And just by way of reference, so, having worked at MVP for over a decade now and being in a position where I'm constantly having to pull together different, subject matter experts in areas of the business to facilitate kind of a cross-functional response to questions like this. That can take weeks. So, that was the general feedback from our actuarial team is just to urge caution not to make an already complicated and costly process more burdensome, but open to, suggestions on ensuring that the questions can be asked, and that if they're specific to the filing and we're able to answer them in a reasonable time frame, we're prepared to do that.
Any questions for Jordan? All right, well, thank you. Hello. Wondered if you had comments regarding.
Thank you. Why don't I start, Charlie, and then you can pick up with the details and you can correct me where I go wrong. Thanks for the opportunity to respond. The first thing to say is, I think maybe I said this earlier the other day, but the practice that we have, particularly with Blue Cross, is particularly good. We ask our questions and Blue Cross attorneys reach out to us directly, raise concerns about our questions, and we work it out together, and we don't go through a formal process. So I just want to mention that we've been able to come to agreement with Blue Cross in the last couple of years, ever since Blue Cross moved to its current attorneys, I think. But I think, and so, 2017, I think that was my first year. I think I started in January of 2017 at the Healthcare Advocates Office. So that's kind of a while ago. But I understand the concern being raised, and I think it makes sense to turn to Charlie to just remind us of what the process would be as we're proposing it.
Sure. So, I think we heard Sarah Teachout say that it's for me, I heard it sounded like her understanding of what we were proposing is that there would no longer be the possibility that insurers could object to our questions. And that's actually not what we're anticipating. We had a conversation with General Counsel Barber the day before a meeting with you all, and he asked the same question. Are you anticipating that carriers would no longer be able to object? And honestly, no, that is not what we're expecting. I mean, we prefer that there be no objections, but we still leave out the possibility that even with these questions that we are now saying shall be presented to the insurers, that as would be the case in a court of law, if a question is posed and the other side thinks it's not an appropriate question, there's an opportunity to object. So, and the reason for this would be, I mean, this was already asked here in the committee today. What is reasonable and what is directly related to the filing? Well, different people might have different interpretations about what is reasonable and what's directly related. And someone has to be the arbiter of that. So something that the HCA thinks is reasonable and directly related might not be what Blue Cross thinks is reasonable and directly related. And the person who would have to decide that is the Green Mountain Care Board. It would be General Counsel Barber, who's in the position of receiving these questions and working out any differences between the two sides. As Mike mentioned, I mean, current practice is that for the most part, we're able to work out our differences with the attorneys representing Blue Cross and Blue Shield. And that is a good process. and that's, something we'd like to be able to continue with moving forward. I think what I heard being said was that reasonable or relevant is the lowest standard. I'm not sure that I agree with that. From my perspective, relevant is the standard and reasonable is not. So I think if we could move us in a direction of The language being that we have the right to submit in writing questions that are relevant to the rate filing and to the review criteria. So relevant to the filing, which I think is I mean, obviously that's what's at stake at these hearings are the rate filings themselves. But as I said yesterday, there's more than just an actuarial review of these rates. I'm concerned if the language says directly related to the filing, that opens up the possibility that questions that get around affordability, access, and quality, which are the non-actuarial review standards, but they're in statute. These actuarial filings, the rate filings are largely actuarial documents. And if we stick with the language directly related to the filing, I'm concerned that we're going to lose our opportunity to ask questions that get at the non-actuarial factors. That's why to close, I'd say we would prefer language that says relevant to the rate filing and to the review criteria. Thank you. I'm sorry, I probably said too much
Say that
there.
again, relevant to the filing
Review criteria.
and the review criteria.
Exactly. Relevant questions relevant to the rate filing and to the review criteria.
So, does anyone have any questions? Leslie?
I'd just like to ask a question of you that I asked earlier is, do you have other opportunities throughout the year to get questions answered by insurers? Or is this really the once a year opportunity?
This is really the once a year opportunity for us to ask questions of the insurers.
Thank you.
I mean, and certainly we could ask a question of the insurer at any time, but this is our opportunity on the record to get an official answer.
Right.
You mentioned factors. I forgot the exact language. You said factors besides the factors beside
So
the actuarial documents or something. What are can you give us some examples of what those factors might be?
Yeah, so they're in statute, and I wish I could point you exactly to. I mean, they're in 8 VSA 4062.
Yeah, I'll look it up if they're in.
Yeah.
You don't have to do it.
And the big ones are whether the rate is affordable and promotes access to care and promotes quality care. Those are the big three non-actuarial factors: affordability, access, and quality.
And so you want to be able to ask questions about those things, even if something has not been submitted on the record yet, like to gather more information about those factors.
That's exactly right.
Like qualitative data in addition to quantitative.
Exactly.
All right, thank you. I understand.
Any other questions? Or do we, 1, 2, 3, 4, 5, 6, we're good. I guess I just have, so right now, the process, I understand the process that's used for the healthcare advocate. Is there any stipulation around what the board can actually ask during the rate review process? Is there anything in language that they're only allowed, or can they ask whatever they want to ask?
I think they can ask whatever they want. Is that right, Charlie? I can't think of any place where there's any limitation.
I think that's right. I mean, the only limitation is their own sense of what's reasonable for them to be asking or relevant for them to be asking. Yeah.
And it's worth noting, we have never seen a carrier object to a board question. It's a common practice for carriers, or one carrier lately, to object to the HCA questions.
So I guess my other, the thoughts that are swirling around my head. You have a great working relationship now with the attorneys, the lawyers at Blue Cross Blue Shield. They answer your questions. Everything's wonderful. What happens when those attorneys are gone and they've got new attorneys? And what happens with the next new chief healthcare advocate who, in your own words, it was your first year, it appears as you were trying to be an overachiever. What happens when the next one comes in and tries to be an overachiever too? So, you know, what is reasonable language to stop that? And also give parameters when the working relationship, because people are always going to be changing, when the working relationship is not so wonderful.
Well, Mike, okay. So I said yesterday I had language ready to go. So and the full thing I have written here, and it would place, I think, some further guardrails on this process. Mike, I ran this by you as well. I ran this by Eric, and I ran this by you. Um, uh, that it would be that the HCA, on behalf of health insurance consumers, may within 30 days of a rate filing submit to the board in writing no more than 25 questions, including subparts, relevant to the rate filing and to the review criteria that the board shall ask the insurer. So that 25 questions, including subparts, is the exact rule, federal rule of civil procedure. The Vermont rules of civil procedure do not place a limit on the number of pre-hearing interrogatories a party can ask. The federal rules of civil procedure do, and that is 25 questions, including subparts. And again, relevance. So it refers you to a standard of relevance. And the relevance standard, I'm gonna not get it out here exactly right, but it is a question that attempts to elicit factual information about a fact that's in dispute at the hearing. So here I have in mind more than just the actuarial figures that are in dispute at the hearing, but also the non-actuarial matters that are in dispute at the hearing, the affordability, access, and quality of that behind those rates.
Jordan, are you still there?
I am.
Does New York State have rate review at all?
We do, and it's a very
there-
different process. So
Is there an equivalent of a consumer advocate?
yeah, so the process in New York is I would say fundamentally different in that, you know, the state reviews, amends, modifies, rejects, approves rates in these same markets, but they don't have it's not a formalized legal proceeding like it is here. So our rates go in, you know, there's back and forth with the insurance department here. We have the ability to appeal a decision they've made on our rates, but there's really no, you know, legal proceeding around this. And, you know, to be fair, it's a little easier to maintain that type of standard in Vermont versus New York because there's a lot more carriers in New York submitting rates across the market. So that would take a lot of time and resources on the part of New York. So we don't get into this level of detail as to what we need to provide and you know, submit and to be a participant in the QHP markets in New York. And that rate review authority in New York doesn't extend to a formalized legal proceeding like it does in Vermont.
Okay. Brian?
When you say formalized legal proceeding, I'm a little confused. Are you referring to the open, transparent, public process of the Green Mountain Care Board? Like, is it more of like a contract negotiation that's private between parties in New York? Because I still see that as a legal process, but that's why the proceeding part. So can you explain that a little more?
No, good question. I think your interpretation is fair that when I say legal proceeding, you know, the fact that, you know, MVP, our actuary, has to show up and testify and answer questions, and it's conducted in that fashion like a legal proceeding. That doesn't exist in New York. But to your question, to your point, yes, I mean, there are legal standards. There's back and forth between, you know, the insurance department here, their actuary, they're asking, you know, questions. There's a public comment process where the public can submit comments, and there are consumer organizations that participate in that process, but we don't have a well-defined kind of quasi governmental agency, for lack of a better term, like the healthcare advocate that is really plugged into the process in New York.
So Alyssa, let me just, Madam Chair, let me just say quickly, your question is right about how does this process change and evolve as the people after us take the place. And And I think the answer is that if there's disagreements between the Healthcare Advocates Office and the parties, then the parties will object. And the Green Mountain Care Board will have to make a decision about what's a relevant question and what isn't.
Sarah?
Great, thank you. Sarah Teachout with Blue Cross and Blue Shield of Vermont. A couple things about the process. So in rate review, it is a judicial hearing with all the lawyers involved. You can compare it most directly to hospital budget review, which is again, an open and transparent process, no lawyers, right? And then the other thing I would say is that because it is this very legal judicial process, it costs a lot of money. So yes, we have outside attorneys working for us. And every time we want to object to a question, it takes a lot of attorney time to do so. They have to make the legal argument, they have to send the documents in. Then the Green Mountain Care Board attorneys have to make a decision. That doesn't happen in any other process here. It just adds to the burden. And quite frankly, it's ratepayers that pay. All of the costs of this entire process for the Healthcare Advocates Office, for the Green Mountain Care Board, and for the insurers are built into premiums. So we're just asking to be more reasonable and contain the questions to the rate.
And I think my response is every year after rate review, we think about figuring out ways to improve this whole process, and we would definitely engage. We don't disagree with Blue Cross. This doesn't have to do with our questions, honestly. This whole process is quite burdensome, and there probably are ways to improve it. But I don't think it has to do with our ability to ask questions.
Do you feel as though, and I see hands, do you feel as though the insurer's position has merit? Can you appreciate their position, I guess, is what I'm saying.
I certainly appreciate their position. I am not at all surprised that they don't want us to be able to ask questions directly. There's no surprise there. Nonetheless, we think, if you're gonna, I said this yesterday, and I say it again, if you want a public advocate as a party to the table, you gotta let us be a party at the table. You can't tie an arm behind our back. Today, I think that the process has tied an arm behind the public advocate's back, and we're not able to develop a case on behalf of the public.
Sarah, and then Brian and Leslie.
So Sarah Teachout with Blue Cross and Blue Shield of Vermont. We are not objecting to the healthcare advocate's request to ask questions directly. We just want to put guardrails about the types of questions they can ask. So that is still a significant change over what's happening today.
Yeah, and we don't have full agreement about what those guardrails. That's
Okay.
where we're at.
Jordan, and then
Yeah, very quickly, just to echo Sarah's feedback, we have the same position. It really has nothing to do with the healthcare advocates' questions. It's just more about ensuring that the process is flexible and reasonable enough for us to balance a lot of demands with limited resources on a tight timeline. So if the questions become, are broader in scope or require more resources on our end to put together a response, we would just want to have some level of flexibility, whether that's objecting to something or the board revisiting its timeline and expectations around us providing that that information. And I will just add, if I could, real quick, I'm not an attorney, so to take that as a caveat, but in talking with our attorneys about the term, legal term relevant versus related to or reasonable, it's the feedback I've gotten is that under federal rules of evidence, that relevant doesn't appear to be that's kind of an outdated standard is what they've shared with me, and that those rules tend to focus on related to or directly related to or material. So again, not really having the attorney background there, that is the feedback our attorneys did provide, and you would just want to put that out there for reaction as well.
Apologies, guys. I'm late for another meeting. So,
okay. Oh,
Yeah, all I was gonna say is that it sounds like the cost that we're hearing that the cost of the legal expenses to manage questions about the cost are driving up the cost. And so that is concerning. I guess my question that I don't expect answered today for us to think about, like everyone, is there a more restorative practice-based approach we can take versus litigation-based approach? Because maybe there's a way to improve the process so that we don't need lawyers, because lawyers are expensive. And on both sides, if there was, that's all. I don't expect an answer today. I'll think about it myself.
Many of us actually have to get going. Leslie, did you have
Well, I really
Mike
care.
is actually gone now.
Yeah, I see that. I mean, I'm just gonna say, I really care about quality, affordability, and access. I think we can't lose sight of that, those qualitative factors. We always hear that it increases rates, everything increases rates. So I don't think we should give up our access to information because of that.
Great. If you can send your suggested language to us, Charlie, that would be great. Because I was trying to write it down, but I got lost in it. And I think we're done for the afternoon,
Today, morning, I hope.
morning,
I was excited.
whatever
for a
time it is.
second.
We're done for the morning.
I could go home.
Be back here another time.
Oh, no.
Or no, we're not back at 1. After floor, we're back.
Sorry.